Good morning, everyone. Welcome to Global Compliance Panel's live webinar on how FDA trains its investigators to review CAPA and what you should do to prepare. My name is Michael, and I will be your host today. Today's webinar is presented by Mr. Jeff Gassif. Mr. Gassif, RAC, is the Director of Quality at Medivators, a leading manufacturer of endoscopy consumables and instrumentation. In his 20-plus career in quality and regulatory affairs, he has implemented and overseen CAPA systems and has been FDA liaison for and participated in dozens of FDA inspections. Jeff has prepared responses to 483s and warning letters and participated in face-to-face meetings with FDA officials. Jeff received his regulatory affairs certification in 1996. We are honored to have such a distinguished person such as Jeff Gassif with us to present the webinar. And just quickly before we begin, I just want to outline the program for today's session. This webinar is again for a 60-minute duration. First, Jeff would go and take you through today's webinar, highlighting the areas that would be covered, and then he would go ahead and share his presentation. We also would like to inform you all participants that once part of this teleconference, you have been placed in mute and will remain so until the Q&A window begins, which should ideally be towards the end of the session. This is just to ensure that there is no discontinuity during the session, and also to ensure that the presenter could speak clearly so that everyone can take maximum benefit from this webinar. And we also request all of you to hold your questions back until the Q&A window begins. 10 minutes of time will be allotted during the Q&A session, which would be at the end of the session. And for any reason, if you do get logged out, please join in again. The method is the same. You just need to follow the same procedure. And now that we're all ready, I do request Jeff to go ahead and take it from here. Jeff?
Thanks so much for the introduction. Let me welcome everybody to this webinar. For those of you who have not attended webinars before, I think what you'll find really is the only detriment is that I can't see you and you can't see me. The benefits are many, primarily of which is the fact that you don't have to travel. And so those of you who either are near the East Coast or would have to have traveled to the East Coast, you don't have to do that. Today's topic is about CAPA, and it's not just about CAPA, which is corrective and preventive actions. Sometimes I'm not sure of the knowledge and experience level of many of the attendees of my webinars, so I try to define things at least up front. Corrective and preventive action always has been, as far as I can recall back, and probably always will be, if I can try to predict the future, the single most cited type of nonconformance during an FDA inspection. There's so much involved in corrective and preventive action, beginning with analysis of the data to a complete and total root cause investigation, to determining corrective action, verifying or validating it, implementing it, training on those corrections. There's a lot to it, so it will be and is the single greatest nonconformance cited by FDA. Your goal is to pretty much try to understand that and realize that the best laid plans of mice and men, et cetera. So when you're looking at your CAPA system, you want to make it such that the system is robust enough that any nonconformances you have will be nonconformances with your own system, such as forgetting to fill out forms or something to that effect, as opposed to having your system or your practices be non-compliant with the regulations. So the focus of today's webinar is how the FDA inspector is going to review your CAPA system, and in advance, what you can do to prepare for their visit. Your goal when it comes to an FDA inspection is to have systems in place, obviously, that are compliant, but also to prepare for their visit. Your systems have to be easily understandable by somebody who is not at your company. Many companies use terms, just as an aside, company I work with uses bill of material, when they really mean device master record. So they have to define that in their procedures. Similarly, you're going to have practices that you do that are not exact representations of the definitions in the regulations. So make sure that you customize and you have explanations in your procedures and your practices to make sure that the inspector can understand and appreciate the compliance of your system. There are several documents that the FDA inspector is going to use to evaluate the adequacy of your CAPA system. The first one is the IOM, and I've given you the citation here. The second one is the CPG, the Compliance Program Guide Manual, and I've given you the citation, the link here. And the QSIT, the Guide to Inspection of Quality Systems, the QSIT manual. This is the one that I'll end up spending my most of the presentation on. For this is the one that they will actually go step by step and evaluate your QSIT system. This is 108 pages of deliciousness, and I'm being sarcastic, of course, but what I want to be serious about is make sure you have someone at your firm who has read the QSIT manual. You've got to have somebody who knows exactly what it is that the FDA is going to look at, not just with regard to CAPA, which is what we'll cover here, but their inspectional objectives for all their other systems. Beginning with the Investigations Operations Manual, Section 5623 talks about your quality audit. And where it brings in CAPA is in the second bullet point here, because the preamble to the IOM says that corrective and preventive actions under internal audits are not covered under the exemption. So the exemption states that the internal audit reports are exempt from FDA review. The FDA inspector, while he or she may ask to see your internal audit reports, it's outside their jurisdiction to do so. So you can certainly refuse to let them see this. However, what you must show is proof of your corrective and preventive actions resulting from your quality audit. And the way to do this is to have two types of documents. One is the audit report, and the audit report is the findings. It's the actual nonconformances that your internal audit team located and cited when they did their internal audit. That is one type of report. The other report is the corrective actions that were implemented to address these nonconformances. So many firms have internal audit committees. And what these firms do, the way I recommend you comply with this requirement is, in this audit committee meeting, not include as part of the minutes the actual findings themselves. Just have a matrix, if you will, of the corrective actions. So your first column may be internal audit area, management review, let's say, management responsibility. The second would be a numeric list of the findings, 1, 2, and 3, the responsible parties, and then the fourth column will just be status, not yet assigned, open, closed. And once it's closed, it comes off the internal audit committee meeting minutes. When you make this change to evidence the closure, because the FDA inspector will say, well, I see that it's been taken off this minutes for this month, I need proof that that was implemented. On your ECO or ECN or DC or DCN, the cover sheet to your document changes. You want to specifically reference the corrective action that has been implemented. So under the reason for change, most ECOs have a description of change and then a reason for change. And the reason for change would be something like, as it says here, corrective action in response to internal audit of document and data control performed, which is when the internal audit was performed, on 5/14/07. It might be, it could be corrective action, corrective action in response to finding number 3 of internal audit. So you're showing here that you have implemented corrective action in response to your internal audit while being able to avoid showing your FDA inspector the actual internal audit reports. the FDA inspector will be happy to look at internal audit reports if you show it to them. They're not going to tell you that they're not going to look at them. Every time I've ever been involved in FDA inspections, they look at whatever you give them. The IOM 7232 under device recalls, corrective actions, I'm not going to read all of these, but as you can see, these bullet points speak to the corrective action taken to correct a device recall, the corrective action, that is. So it's not the correction, but the corrective action, describing it, qualifying or validating it, responsibility to assure that it's completed, and then you have prevent, bullet point, and item 4 is prevent recurrence, such as preventive action. Never forget that there's a P in corrective and preventive action. Many firms I know, during their monthly quality data meeting or quarterly quality meeting or even executive management review, neglect to specifically reference the preventive actions that they've done. So anytime you have a preventive action that you do, because we all do preventive actions, make sure that you explicitly reference it on any sort of interdepartmental report such as that. So in summary, 7232 talks about the device recalls. And again, each of the previous 8 issues on the slide here, which is the sections of the IOM that the inspector is going to look at, has a method of compliance on this particular slide. Admittedly, some of these methods of compliance are a bit generic. Unfortunately, that's due to the extensive material I want to cover during this webinar, unfortunately, plus the length of time. For example, bullet point 8, assuring the effectiveness of corrective action. There's quite a few schools of thought as to how a company assures that corrective action is effective. The way I choose to do it is to monthly or quarterly look at my corrective actions, and then look at the nonconformance that corrective action was chosen to correct. Perhaps it was a complaint trend on a particular glue joint that came apart, just for example. And we redesign the product and we change the glue and we change the gluing mechanism. I will look at the complaints for a 12-month period to make sure that corrective action, was effective, which is to say that none, or at least very, very few complaints were logged alleging that glue joint came apart. The CPG manual provides guidance to the FDA. It's a very top level, very 30,000 feet type of document. It focuses, as it says here, on corrective action in response to previous inspections. So what it speaks to is the levels of the inspections when the inspector is looking at CAPA. Level 1 is an abbreviated inspection. And what the inspector will do is they will look at 2 subsystems, CAPA and either production and process controls or design controls. That's entirely up to the opinion of the inspector. And what they're going to do is they're going to look at the corrections and the CAPAs that you've done from the Form 483 items. This is not to imply that a firm had 483 findings, but Form 483 is the Notice of Adverse Findings on which the inspector documents the list of their findings. So during an abbreviated inspection, the inspector is going to look at their last Form 483 that they cited your firm with, and then they're going to look at the corrections and CAPAs that you implemented to stop those from happening. A level 2 inspection is the comprehensive inspection. That's the one that's, well, they used to say every 2 years, then it was a goal of every 2 years, and now any sort of frequency like that is just out the window. It includes the subsystems. It includes our management controls, design controls, CAPA, and production and process controls. The third level of inspection is a compliance follow-up. And what happens here is your firm has had a previous inspection that resulted in what the agency calls further action, which is something beyond a Form 483. It's a warning letter and above, which requires requires that your firm perform action. In this type of inspection, the inspector is going to verify that your corrective actions were effective and that they were implemented to address the violations. I put a quotation a little bit. What we'll say to the attendees, what the moderator and I will say later on at the end is if there are any questions, contact Global Compliance Panel, and then they will contact me, and obviously that remains the same. So if there's anything that was a little unclear in the slides, feel free to contact us and we will reply very quickly. Where I was speaking to the Compliance Program Guide Manual of levels of inspection. So what we covered, just to maybe take a quick step back, is level 1 is an abbreviated inspection. Level 2 is the comprehensive, it's the standard inspection that we see. Level 3 is an inspection that requires compliance follow-up because your sanctions were so dramatic as to require so. And level 4 inspection is a for cause inspection. And it's a appointed inspection for a specific reason. Usually, so it's either information that raises questions, concerns, or problems, or focusing on a specific quality problem. In my experience, usually it's the former of these two. Quite honestly, what this is that somebody has brought something to the attention of the agency that requires them to send an inspector to verify the accuracy of that. Either there has been a recall of a component that goes into one of your convenience kits, for example. That happened to me firsthand. Or a little more prevalent than that is, for those of you who are not aware of this, the agency has agency representatives, spies if you will, at most trade shows. And they will go near booths or just overhear what people are saying. And if documentation of unreleased products or documented claims that are not warranted to come out, the agency will actually come to your firm with that documentation to follow that up. That's a for cause inspection. During this inspection, they're not going to look at your production and process controls. They're going to specifically look at the reason that brought them there, the document that brought them there. The CPG manual in Part 3A, Section 1, inspection strategy, requires the inspectors to look at post-market information. So when they come to visit your firm, they're going to look at previous observations, and as previously, they're going to look at corrections and corrective actions for the observations that they cited you for. So, which is to say, anytime you document a response to a 483, make sure that you don't just implement corrective action, but you assure effectiveness of that corrective action. And the way to assure this is to respond immediately after the inspection, specifically reference the CAPAs that you're going to implement, including the projected due dates, excuse me, and as the changes occur, provide an updated response to the agency, and then a final update upon completion, and then just a summary. What begins most inspections is the FDA inspector verifying their previous findings, that their previous findings have been corrected. If they have been sent all the supporting documentation, they'll bring that with them, and then their review of verification of effectiveness and corrective action will be much shorter. Your goal during an FDA inspection is to have them in and out as quickly as possible, and providing them updated responses and a final update, and then a summary of the corrections and the CAPAs makes that come true. I don't want to spend more than just maybe a minute talking about regulatory follow-up, but any corrections and corrective action proposals that you submit to the FDA, this is in response to recalls, warning letters, the seizures and injunctions, all the way up to detention. You have to be careful when you submit corrective actions proposals, because the FDA will look at them with a fine-tooth comb, a finer tooth comb, let me just say, than they would if it was just a corrective and corrective action in response to a 483 finding. Hopefully none of you are or ever will be in this type of situation. And as I said, all interactions response should come from a company official, and here's a list of the items to include in this particular response. And everything you write FDA will be included in their recommendation, or hopefully lack thereof, for legal action. Now begins the part of the presentation that I think you all came to see, which is the QSIT manual. And the QSIT manual, as I said, has 4 major subsystems and instructs the inspectors on how to conduct an inspection. It's an evaluation of whether the firm has addressed the regulations by the manual itself defining the procedures that they're going to inspect to. And they want you to define your procedures as well, and they want to make sure that you've implemented your own procedures. Each subsystem they're going to inspect has something called inspectional objectives, and this is where the QSIT manual gets very helpful. It lists numeric inspectional objectives, and as you've seen in the presentation, I'm going to show you the objective, then we're going to give you a recommendation on how to comply with the objective. So for objective 1, the inspector is going to verify that your CAPA system that addresses, it should be QSR, excuse me, the requirements that you have a CAPA system procedure. And the inspector is going to look at your CAPA procedure to make sure that it addresses problems in response to existing nonconformities, but also preventing recurrence of the problems, so corrections and corrective actions. And the procedure should also address each of the requirements for the CAPA subsystem in your procedure. The inspector is also going to look at your CAPA procedures. Gain working knowledge means just read your procedure. And anything that's vague, any kind of definitions, they're going to ask you about. And your procedure should also have in it what data you identify and input into the CAPA system and how you get that data. The way to comply with this is you have 2 options here. Most firms have a CAPA procedure. Other firms, usually it's smaller firms for some reason, I'm not drawing a correlation at all, will have a quality manual, and it will list in it, I've only seen this once or twice, procedures that involve CAPA. I mean, there's CAPA involved for complaint handling, supplier management, in-process evaluations, and they're a little different sometimes. So that's why some firms have the quality manual aspect out there. Any type of words that are ambiguous, make sure you define them in your procedure, and this will assist because previously, as you saw during the objective, the inspector was, one of their responsibilities is to make sure that you define all terms. Well, if you have correction, corrective action, preventive action, et cetera, defined in your procedure, you've covered that. And take a look at 820.100, 820.100 that is, and everything that's in there, make sure your CAPA procedure references each and every one of those CAPA requirements that you will implement them. Also, make sure the procedure requires that you correct a problem and prevent a problem from recurring, or, this is an important or reduce its likelihood. You should, I'm going to say never, reference anything in any of your CAPAs or in your procedure that says that you will implement corrective actions that prevent recurrence of problems. You can't know that. No matter how robust your validation is, there's a chance that when you validated it on 3 or 16 or 82 units, that when you start to sell thousands or tens of thousands of product, you're not going to see that recur. So as long as your validation reduces the likelihood of it happening, and you measure that by quantity, then you've done a reasonable job of corrective action. Your procedure should also define how you identify the quality data. Where are the quality problems, and what type of non-conforming data do you use that you look for? And where is the data reported? Do you have complaint committee meetings? Do you have material review board meetings, service department meetings? What type of meetings do you have that the data is looked for? Or maybe none. Maybe it's just in various databases or your MRP software. Objective 2, make sure that appropriate sources of product and quality problems have been identified. And it comes from analyzing the sources to identify existing product for corrective action. See, I've italicized those words. I don't want to give any spoiler alerts, but you'll see in a subsequent objective, it won't necessarily talk about existing product and corrective action. So the inspector is going to make sure that you have procedures that require input of problems into your CAPA system, very similar to the first objective. And that the inspector is going to look at your quality problems to identify which ones require corrective action. Not all of your problems will require corrective action, but those that do not need an explanation as to why they do not, either in each individual investigation or in your SOP, in your procedure. For example, we have an SOP that says that individual in-process nonconformances do not require corrective action, but they will be trended, and those trends will determine whether corrective action is required. But however, you have to routinely analyze data from incoming, in-process, and finished device testing, also post-distribution data, complaints or service activities and returns, and concessions, which is to say, anytime you determine that a non-conforming product is going to be dispositioned as used as is, you're obviously going to have the approvals to implement that. But you've got to trend that. That is a non-conformance. Just because you have determined that it's used as is, you still need to analyze that data. As I said earlier, make sure that your CAPA procedure describes how the problems get fed into the CAPA system. Who or what department has responsibility for surfacing the problems, and what type of problems are surfaced? Isolated occurrences, trends, etc. And from where do the problems originate? We'll show data analysis to be included in just a moment. You've got to have a process to analyze product equality problems. As I said earlier, some require corrective action and some don't. Your procedure should talk about who determines this and where it's documented, unless your procedure itself says something. And something that is used, that I've seen used across the industry, is a periodic interdepartmental body. I've been at firms where they have a quarterly quality meeting, admittedly smaller firms that can do it quarterly. Other slightly larger firms have monthly meetings. So it's at these interdepartmental meetings where the attendees determine, based on the trends, whether corrective action is or is not required. And if it is not, why not? I know companies that say, here's all our data, and any, for example, in-process data that has a reject rate below 0.5% does not require corrective action. Well, there you go. That was easy. And that's something that you can do in your procedure. What data is analyzed routinely? You need to make sure that you list in your procedure what data is included in your analysis. And here are just some examples that are gleaned directly from the inspectional objective. Objective 3 looks very similar to Objective 2. These are objective lenses, by the way. Confirm the second sentence. Confirm that data is analyzed to identify potential problems that may require preventive action. This is the part of the inspection where the FDA inspector is going to say, do you do preventive actions? And the answer better be yes, because the inspector is going to look for preventive actions, and they're going to ask you, and you're going to show them. That's fine. That's fine. The third bullet point is very interesting, and it's just while perhaps intimidating upon first read, of course, when you trend data, you're going to be capturing and analyzing data regarding in-conformance product. That is to say, if you have a 99% yield, if you have a 1% reject rate, you also have a 99% pass rate. So by that nature, you are meeting the bare minimum of capturing and analyzing data regarding in-conformance product. If you have a higher risk device, you may want to take that a step further and implement statistical process controls, which is to have alert and action limits for in-conformance products. So while your action limit may be actually a rejection or a trend for rejections, your alert limit might be X% above that. So when the trend starts to go down, you are analyzing in-conformance product to take preventive action to stop something from going out of compliance. So what you want to do is identify all of your problems that may require preventive action, and as I said earlier, look at your trend-based nonconformance information. Also, as I said earlier, you're going to have taken preventive actions. If you have a catheter product line, let's say, and you're getting complaints on the 7 French catheter, you may determine to do a design change to the 7 French catheter, but also do the similar change to the 9 French catheter, upon which you've received no complaints. That's preventive action. Feel free to define your preventive action very liberally to be able to say that you've done preventive action. Some firms have implement lean manufacturing practices, and those lean manufacturing processes, part of that is the Kaizen event, in which you analyze your process to try to remove non-value added steps from the process. That is an excellent preventive action. And once you trend all test and inspection results, and you investigate negative trends that are still in nonconformance, you are implementing preventive action in a situation like this. The next objective is for the inspector to challenge your system and make sure that the data received is complete, is accurate, and is timely. So the inspector is going to look at 1 or 2 quality data sources, complaints and incoming inspection, for example. They're going to review the records. They're going to look at the raw data to make sure that the data was entered into the CAPA system. So they're going to look at, let's say, a month's worth of incoming inspection records and see that the CAPA system analyzed them. They're going to look to make sure that the data is complete. The example I've given here is actually complaints, so that the complaints that you received, the 106 complaints received that month have all been fed into the CAPA system for evaluation. The inspector is going to make sure that the data is accurate, so they're going to look at an in-process test, for example, and look at the reject quantities and make sure that that quantity of rejects was the exact quantity that was fed into your CAPA system. And timeliness. There's no way to define timeliness, but the inspector can tell you whether something is not that timely. What they're going to look at here is when the data was generated, when the incoming product was rejected, for example, and when that rejection was analyzed, was fed into your CAPA system. Usually if it's monthly or quarterly, I've been involved in those 2 CAPA review types of situations. Never had an FDA inspector tell me that that's not timely enough. I would imagine, though, if you only look at your data, if you only enter things into your CAPA system for your executive management review, that might be something that the FDA inspector would have an issue with. The way to comply with this is by internal audit. Make sure that for all intents and purposes, you're only required to perform internal audits on each of your subsystems once a year. CAPA is such a critical system that I recommend you put it on your internal audit schedule for twice a year. And when you do it twice a year, what you'll end up doing is you'll hit each quality data source once a year to make sure you do that. So you won't necessarily, well, you'll still be sampling data, you'll make sure that you're not sampling quality data sources. So for example, January incoming and in process, June, concessions and complaints, and service examples also. And as part of the internal audit, you look at the data that you're analyzing, and you make sure that it was fed into the CAPA system. I know some firms who do blitz reviews. And what these are, let's look at complaints, for example. So the blitz review is usually done completely off the books. And what happens is whoever's doing the blitz review will take a particular month's worth of complaints. And they'll spend some time and they'll just go through the file. And they'll look at the forms, and they'll look at the information, and they'll look at the addresses. They'll look at everything on each complaint. It takes a little while. And they'll make sure that all the information is contained there. And then they'll also make sure that the information has been fed into the CAPA system. So it's more of a offline kind of thing where you're just making sure your goal is to do anything you can to bring your company into compliance. And not everything has to be, not all of your evaluations have to be documented. Anytime I want, I can go into my files just to make sure they're accurate. I don't have to record that as an internal audit. The next inspectional objective verifies that, takes a look at your statistical method and looks at whether analysis across different data sources is pulled together. What this requires is that you look at in-process and field reports, complaints or service issues, at one time, and we'll talk about that, how that pulls together in just a moment. The inspector is going to look at how you analyze your data, statistical, non-statistical. They're just going to look at what you do. And here's where it gets key, that the comparison of problems across data sources is global. And what that means is that if I have an in-process failure of from a particular device, and that reject rate is increasing, that I make sure that I look at my complaints for the same product line to try to tie the two data sources together to establish what they call a global view of a problem. If I'm able to capture all of these types of rejections in process, but they never hit the field, that shows that I'm doing a good job of capturing that data, and my acceptance criteria, my test procedure is a good one. However, as my in-process rejects rise, so do my complaints in the field for the same characteristic, I'm not doing sufficient corrective action or investigation. The way to comply with this is just to make sure that in your procedure, in your statistical procedure, and your statistical process procedure, you list what you do, whether you do Pareto's, spreadsheets, pie charts, even non-statistical things like monthly complaint committee meetings or quality review boards. That's fine, and describe that in your procedure, as I've said. Compare service records to complaints in process to final inspection. And from a risk assessment perspective, you're going to be determining probability of occurrence per ISO 14971, which is the risk assessment determination. When you design a product, you have to put together a risk assessment. But when you receive complaints, you may have to increase the likelihood of your risk assessment. And that's something that you've got to take into account as part of Inspectional Objective 5. This is a form that I've seen used in the past to determine whether you need to take field action. So you're determining risk by doing this on complaints, for example. You're graphing severity against likelihood to determine whether there is, using a 0-0 graph here, this particular nonconformance has no effect on functionality and no effect on safety. Perhaps it's just cosmetic. And it has no chance of recurrence. In my experience, that's usually difficult to conclude. But on the other hand, if you have, from a severity perspective, occurrence that could result in serious injury or death that is certain to occur, you're going to have to take some field action when in your risk evaluation for this nonconformance. Objective 6 is going to make sure that you follow your own procedures. And this, again, as you can see a little later on, the nonconforming product is investigated is commensurate with the significance and risk of nonconformity. So you're going to have already implemented something like I've shown you on Objective 5 to help to assist in compliance with this. You've got to also determine in Objective 6 whether root cause is determined. If it's not possible to determine root cause, you've got to explain why your proximal cause is sufficient enough. And the inspector is Objective 6 is also going to take a look at whether you have control for preventing distribution of nonconforming product. So here, the inspector is going to review your procedure on how you conduct failure investigations. You've got to have provisions for identifying failure modes. You've got to determine the significance of those failure modes. Every failure mode, every type of failure, it does not have the same significance. Some have greater patient safety risk associated with them, for example. And how do you do, the inspector will take a look at how you determine whether you need to conduct a failure analysis as part of the investigation. The inspector is further going to discuss how you determine whether CAPA is necessary. And again, if you have this in your procedure, this discussion is moot. And the inspector is then going to look at failure investigation records of more than one failure mode. One isn't sufficient to determine any sort of trend. Well, maybe two isn't either, but this is what the guidance document says. And they're going to make sure, as I said, you're following your own failure investigation procedures. And every failure mode that they look at when they're going to sample these multiple failure modes, they're going to make sure that they're going to look at your data summaries and your trends to make sure that these sampled failure modes have been captured in there. They're going to look at whether your investigation was sufficient to determine the necessary corrective action. So they're going to look at one significant failure investigation. The way they determine significance of failure investigations is just one that resulted in a corrective action. And they're going to look at root cause, and then they're going to look at verification or validation of the corrective action. And any failure investigations that they find that they determine to be incomplete, they're going to look at whether any unresolved nonconformances and did you distribute any nonconforming product because of these unresolved nonconformances and incomplete failure investigations. Any records that you determine where CAPA was not necessary, they're going to want to look at those reviews. And then they're going to also look at your nonconforming product and use as determinations. They're going to look at your records of nonconforming product till they find what many firms call a process deviation. And they're going to make sure that that process deviation contains some sort of determination of risk, meaning is this as a process deviation, maybe a replacement of a component for a lot or two, is that going to impact patient safety? And if you have a deviation form, never write as the reason for the deviation, market requirements. That is something, as you can see here in Objective 6, that the inspector is explicitly warned against allowing. And they're going to make sure that you have a procedure for making sure that nonconforming product is not distributed. The way to comply with this is, first off, to make sure your procedure describes your own failure investigations, the classic how, where, when, why, and who. Well, maybe not necessarily why in this case, but how are failure modes identified? By explicitly referencing each type of data source. And many firms I know have a standardized document, and I'll show you that momentarily, on which all of your failure investigations are documented. It works out really well because once the inspector has seen that document, he or she gets comfortable with it as the inspection progresses. And as you saw several slides ago, the quantifying the significance of the failure modes is done by a risk analysis of graphing likelihood and severity and determining that since you have an acceptable risk level that you don't need to take any sort of further actions. Where do you make sure that your procedure requires justification if no failure analysis is conducted and if no corrective action is necessary in response to a trend? This is a admittedly small version of a product nonconformance investigation report. And as you can see, the first section is level, and it talks about the origin of the nonconformance. Is it a particular complaint number, maybe or under field report? Is it in process, or is it other? I always like to have other on forms. The second section is the information about the particular product or part that has failed. And the third section is a summary of the nonconformance, just a report, a regurgitation, if you will, from the original nonconformance report goes right here. The next section is the investigation. What the design investigation, the DOI, is what is going to be done from an investigation perspective, and then that's immediately followed by findings, which is what it was that the investigator found from a nonconformance perspective. Was the summary of nonconformance accurate? Or maybe you were unable to confirm the nonconformance. Followed from a conclusion perspective by immediate cause and root cause. Sometimes immediate cause and root cause are the same. Sometimes they're different. Make sure that you take your investigations to as great a detail, as great a level as you can from an immediate and root cause distinction. And then after the conclusion is completed and the investigator signs their name, one of your interdepartmental bodies should review this record of investigation. It's either going to be your material review board, if it's an incoming component. This company has a quality review board, which meets quarterly to look at quality nonconformances, or a complaint committee, which usually meets monthly to look at complaints. And it's not the investigator that determines corrective action. It should be an interdepartmental body. Some investigators, some engineers, I'm not one by the way, are very enthusiastic, and once they determine a root cause, they want that to be fixed. And they might have a corrective action that they think is a wonderful idea, but without determining from perhaps purchasing if it's a replacement component, or manufacturing if it's a change to the manufacturing procedure, how cost-effective that recommended change might be. Well, let's suffice it to say that you want to have more level heads, more people representing the other departments to determine what corrective action is going to be implemented. We want to make sure that when you also, to be able to comply with this, that you comply with your own failure investigation procedures. This form I showed you a moment ago, the PNIR, is a great subject of a blast review, a blitz review, if you will. They call it, for some reason, I've seen it called two different things. I've seen it called blitz reviews here in the States and blast reviews from notified body, from Englishmen I know who are from our previous notified body. Not sure why that is. Good idea is to do a one-time verification. When you have a periodic review, make sure all of your data sources are captured at your first, maybe quality review board, or just your next one if you've never done something like this before. As long as all of your data sources are captured and your agenda stays the same, you're going to make sure that all of your data sources, and hence all of your failure modes, are captured each of your reviews. And make sure that your investigation procedure explicitly requires root cause determination, not determination of cause, but root cause. And make sure that training on your procedure to determine root cause has occurred. Excuse me. Also make sure that all of your failure investigations are complete. Remember that the inspectional objective mentions possible unresolved product nonconformances. So make sure that's something during your committee, your MRB or your QRB or your complaint committee, that's something that you surface, that as the CAPA expert at your company, you're making sure that everybody understands their responsibility to consider possible unresolved product nonconformances. And I like to take at times a defensive position when I look at failure investigations from a risk assessment perspective. I perform a risk assessment to make sure that the risk to the patient is either absent or at worst insignificant. And I use that when I speak to the FDA when they inquire as to how I address risk assessment during my failure investigations. When you conclude that you have NSR, non-significant risk, that even if what you're saying by saying this is that even if you inadvertently overlook an unresolved product nonconformance, as you can see 2 bullet points up, unresolved product nonconformance, there's still going to be no risk to the patient because you've looked at the reported failure investigation and its conclusion, and you've determined whether there is a significant risk to the patient. In your procedure, you should also make sure that you document whatever requirements you have for a use-as-is determination. Some firms use risk assessments. Others use deviation forms. Make sure that either one of these is reviewed and approved. And you should have a final QA inspection or verification. Some firms have a test department that does their final evaluation. If you have some type of final evaluation of your product, you can say that that prevents distribution of non-conforming products. Everything you have is tested, or at least perhaps the lot is sample tested per the ANSI sampling standard. That's how you prevent this type of distribution. Objective 7 is one in which it's going to be determined if appropriate actions have been taken for significant product and quality problems. So the inspector is instructed to review significant corrective actions and just make sure you've captured everything. They're going to make sure that you've captured anything from a preventive standpoint. And by this point in the inspection, not just the CAPA, but the inspection itself, they've had at least a passing familiarity with your nonconformances, with your products and product lines. A good inspector is going to be as knowledgeable enough at this point to ask you to explain your rationale for not extending this action to include additional actions, or maybe additional actions across additional product lines. So you want to define significant corrective action in your procedure, and here's one that's actually from the QSIT. So feel free to use this, as I have many times in my CAPA procedure. And in the investigation or the corrective action record, why did you limit the change? And what you want to account for, and of course exclude to explain why you limited your change, are those actions that are explicitly contained in the QSIT: component supplier, training, acceptance activities, or field action. So make sure on your corrective action record or your investigation, why did you limit the change to the extent you did? Objective 8 is determining whether CAPAs were effective and validated, and that they don't adversely affect the finished device. In this objective, the inspector is going to look at your significant CAPAs, we talked about that a moment ago, and they're going to look at trend results, and that if there were any other similar product or quality problems after implementation. So you implemented your corrective action, but you're still having these problems. What gives? And that now they're going to go to do a little design or process validation because they're going to make sure that your CAPAs have been verified or validated. They're going to also look to see if you've included design controls in your verification or validation. Because even though there are subsystems, there's quite a bit of crossover between subsystems. So the inspector isn't going to ignore design controls when they're looking at your verification or validation of your corrective action. And they're going to look to see if you've implemented good engineering principles. Is there a protocol written before the actual test is performed? Is that protocol approved before the test is performed? Are there documented requirements in the protocol against which output is verified? Is the test equipment used, maintained, or calibrated? You've got to account for that in your validation protocols. And are the test results there? Are they available? And are they legible? Is it just a bunch of scribbles that are unable to be read? You want to make sure that you have a periodic review of quality of trend results and also similar product quality problems after implementation. And the periodic review, as I mentioned earlier, is entirely up to you. What I like to do is failures for 4 quarters. I've specifically referenced field failures here to apply to complaints, but you might have in-process failures for components. If the nonconformance don't recur, or at the least are drastically reduced, you can conclude that the CAPA is effective and it does not adversely affect the finished device. So while you may have had other reports of nonconformances of that device, as long as you're able to conclude that those other nonconformances were not caused by this corrective action, you're good to go. Also, make sure that you have your procedure for validation, process validation, or design control procedure requires pre-approved protocols before testing is begun. And you want to make sure that your design control procedure accounts for both significant changes and non-significant changes, however you define those. Your investigation procedure should make sure, again, pre-approved verification of validation in a protocol, pass-fail criteria, very important. That pass-fail criteria has to be measurable. It can't be preferences. It has to be measurable. I don't mean measurable. I mean it has to be absolute. It can't be preferences. It has to be a requirement. Make sure that the equipment is used, is documented by model and serial number, including expressly writing down on the test report the calibration due date of the product. Not the most recent calibration date, because that doesn't tell you when the calibration is due. It tells you when the calibration was performed, and that's insufficient. And make sure that your procedure talks about how often, and for a period of time, you retain your test results. Objective 9 is going to verify that the CAPAs were implemented and documented. So the inspector is going to continue to look at the most recent CAPAs and make sure that they were documented and implemented. So you want to make sure that your CAPA procedure references your document control procedure, because the overwhelming majority of the time, and by overwhelming majority I might mean every single instance, implementation of a corrective action is evidenced by a corresponding document change. And that document change is going to be a control document, which is going to have to go through what's called your ECO process, or your document change process, with approvals and things like that. But you've also got to have implementation. So how do you know that a change has been implemented? Some firms that have implemented electronic signatures have directories excuse me, upon which documents reside. So all that's sufficient, all that's needed is a notification of the change, instructing people to go look at the directories. Other firms use still hard copy distribute their documents, in which case there's a hard copy distribution document that goes throughout, and you've got to prove, I've got to prove as head of quality that I've received this new inspection document. So I'm going to sign a document, then I'm going to pass it on to the head of purchasing, and she's going to document that she received a copy of the purchasing document. It's another good place for a blitz review. If you look at these, what I'll call ECO implementation forms for several months, you'll make sure that they are completely filled out. This is an example of one. They're really follow-up actions. It's not implicit in the approval of this document change that these things occur. However, for the purpose of business, and in many cases follow-up compliance, it is. So production and inventory control is required to update the network bill of material, maybe revise scheduling or planning. and whether training is required, not required, and if it is required, is it completed. And as you can see, this goes through each of the departments that are required to update or replace their documentation in their department. And once completed by quality assurance at the end, this is forwarded to document control, and they maintain a copy, and this proves that all of these actions have occurred and that documents have been replaced importantly. Inspection Objective 10 talks about dissemination. Who knows that the CAPAs have happened, and to what extent do they know this? The inspector is going to look at your management review, and before this, they're going to look at a recent CAPA event, and they're going to see what records were submitted for management review. Inspectors know that your president and CEO and CFO aren't interested in knowing the nuts and bolts of the corrective action that you recently implemented. However, they need to know something. Some information on CAPA needs to be presented at your management review. So the inspector is going to look at the recent CAPA event and see to what extent it was submitted for management review. I can tell you from years of experience that as long as you have some record of your CAPAs in your management review, you're going to be okay. And something else that's very important is you've got to have something in place to disseminate your CAPA information to those directly responsible, this is a quote, for assuring product quality and prevention of quality problems. And the inspector is also going to make sure that, look for evidence that this information has been disseminated to those individuals that it's required to be. In your management review procedure, you want to require that raw data be submitted. This is just a recommendation that I do meet with a bit of resistance, and I'm okay with it being summary data instead of raw data. The reason I tend to recommend raw data is it's an absolute compliance. You are in 100% compliance this way. But as I said earlier, in my very recent experience at least, the inspectors give us a little leeway when it comes to evaluating to what extent CAPAs have been submitted for management review. So not so much raw data, but at least summary data, something that is significant and explains the corrective action taken. And the attendees at any review board meeting minutes, or at any review board meetings, not so much when it comes to quality management, not when it comes to the executive management review, but more your quality review board, your material review board, your complaint committee. You've got to have at least 2 departments represented everywhere to be in compliance, and that is QA, because that's those directly responsible for assuring product quality. As you recall, the second bullet point here, the inspector is going to look at to make sure CAPA information is disseminated to those directly responsible for assuring product quality. That's QA. And also those directly responsible for assuring prevention of quality problems. In most cases, that's your R&D department. And this way, having their attendance there proves that the information has been disseminated to them. I recommend you put this explanation in your procedure to help. Excuse me. So in summary, we touched several times on how risk assessment is going to be used. In many cases, it's easy to write off the risk assessment, the not performing a full corrective and preventive action by showing that the risk is low enough as to require that. Internal audits, a great tool for assuring compliance. Audit CAPA as often as you can. And last, the best way to comply with this is to restructure your internal audit program so that instead of auditing to maybe the ISO standard format-wise, you audit according to QSIT. This way, you are already asking the questions that you know that you and your people know the inspector will ask, and it gives you a lot of good practice. So that's the end of the webinar, and I'll turn it back to the moderator to solicit Q&A.
All right, thank you so much, Jeff. Ladies and gentlemen, that was a presentation by Mr. Kassoff. In case you have any questions, this would be the time. We are open for the Q&A session. And for any questions for our presenter, you could go ahead and click on the raise hand option, which is a palm-like icon at the bottom of your participants panel, to go ahead and ask questions verbally. Or you could post your questions in the Q&A window so that our presenter, Mr. Kassoff, can read it out loud and then go ahead and answer. And for any reason, if you're unable to ask your questions using either of the two means, please share it with me by chat, and I will go ahead and pass it on to Jeff to go ahead and answer. And if you have any questions, please do go ahead. And at the same time, I just want to quickly let you know that you could go ahead and share your feedback in the feedback form that will appear on your screen in the polling panel right now. It's got about 6 questions and mostly multiple choice, and it wouldn't take you more than 2 minutes of time to answer. And polling will remain open till the end of the session, so you could go ahead and finish up your questions if you do have any, and then you could finish up your feedback as well. I would really appreciate it if you could go ahead and complete this. This would also ensure that if there are any improvements that can be done in this webinar or any future webinars, we will definitely take that as a positive. And yes, if you do have any questions, ladies and gentlemen, please do go ahead. Right, Jeff, I do not see any questions at this point in time. We will give it another 30 seconds to see if our attendees do have any further questions. And also, I just want to keep all of you mentioned that if you would like to get in touch with us, you could always send us an email at webinars@globalcompliance.com. Or if you feel that any of your team members, colleagues might benefit from this webinar, you could always go ahead and avail it in the recorded format, or you could purchase it from our website. And you could call us at 1-800-447-9407 as well. And also, ladies and gentlemen, we would welcome any kind of suggestions and feedbacks from your end on how we can improve the webinars as well. And yes, and I just want to keep you all advised that in case you would like to know about any future webinars from Mr. Kassoff, you do see them on the screen. These are a few of the webinars which you'll find from Mr. Kassoff. We have one till the month of December. And Jeff, I do not see any questions coming up, so we would go ahead and conclude the session. Jeff, any conclusive remarks at the moment?
No, just a reminder to everybody that if you have some questions upon the slides that were a little delayed, again, I apologize, but feel free to forward them to Global Compliance Panel, and we will respond immediately. Thank you.
Yep. Thank you so much, Jeff. All right, ladies and gentlemen, we look forward to having you all again with us very soon. On behalf of Mr. Kassoff and the Global Compliance Panel team, I'd like to thank you all for being part of this event, and hope you all have a good day ahead. All right, thank you so much.